Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Mikhaila Riska. If her name sounds familiar, Dr. Mikhaila has been a well-known chiropractor in the Appleton area for almost 10 years now, and she's the owner of 920 Wellness Studio. But today, we're excited to introduce you to her new business, Fox Valley Functional Medicine, which just opened in April of 2025. At Fox Valley Functional Medicine, Dr. Mikhaila's goal is to help people get to the root causes of their health issues, not just manage symptoms. Her approach combines the best of functional, integrative, and conventional medicine to create truly personalized care plans that empower people to take charge of their well-being. Dr. Mikhaila is here today to share her insights on what true root cause healing looks like, why so many chronic issues are missed in conventional care, and how functional medicine can unlock the energy, clarity, and resilience we're all meant to have. Get ready, you're going to walk away from these conversations feeling inspired, informed, and ready to take your health into your own hands. Let's get started. Hey, everybody. Welcome back to the Motherhood Alliance podcast. We are in episode 4 of our 4-part series with Dr. Mikhaila Riska. Welcome back to our 4th and final episode.
Thank you.
In this episode, we're going to be diving into gut health, which is all over the place if you go in the podcast world or in the functional medicine world, and rightfully so, because it can be really complicated, but also really simple. Like so many different symptoms that people are experiencing in everyday life could all be linking back to gut health. Before we jump into this, I do want to mention that we have had 3 episodes with Dr. Mikhaila before this one. We talked all about functional medicine in general in our first one and kind of what are the different types of tests and steps of the journey. So just if you've never experienced functional medicine, it might be a really good intro for you. In episode 2, we talked more about some specific things that people might be dealing with that functional medicine can help with, like allergies, thyroid disorders, Hashimoto's, pediatrics, more. And then in our last episode, we dove into hormone testing because this is something that a lot of people are hearing more and more about and becoming interested in. And so she really unpacked the different types of hormone tests and how they can be beneficial, especially as we're hitting the older years of perimenopause and menopause and our hormones are changing. So let's dive into gut health. Dr. Mikhaila, why is gut health so critical for overall well-being?
Yeah, I really feel like it's the foundation of our health. You know, there's just so much to be said about what happens in our gut health. I mean, I think most of us know that it is our second brain. So the amount of communication that we have in our gut to our brain, the enteric nervous system, it's just crazy of what the research is coming out from. So we really focus in on the gut health, no matter if somebody is coming in for hormone reports or if they're looking at other issues. We're always going to touch on gut health and the importance of it. Absolutely.
What are some common symptoms that are indicating that your gut might be off?
Yeah, I see a lot of bloating. So many women talk about bloating after eating, and I think it's really important to take a look at what's going on, what's causing the bloating. It might not even be certain foods. It could be a dysbiosis, which means just an imbalance of the good bacteria versus the bad bacteria in your gut system. You could also look at different pathogens, so parasites, Epstein-Barr virus, candida overgrowth. There's so many different things that could be going on in our gut. You could have SIBO, which is small intestine bacterial overgrowth. It's crazy. It's its own little ecosystem down there, and we really have to figure out what's going on and making sure there's diversity down there.
What are some kind of uncommon symptoms that people are experiencing that may indicate that their gut is off? And when I say uncommon, I'm partially thinking about myself a little bit of like, my hands and feet are always cold. Is that something that could be indicating that? Or dark circles underneath your eyes, or allergies? We did talk about allergies a little bit in our last episode, which was really helpful. But what about joint pain or acid reflux or migraines, headaches? People are getting these things all the time. Could all of these things be linked to gut health, or is gut health really more indicative of certain symptoms?
Yeah, you hit it spot on. I mean, everything that you just listed could definitely be symptoms, which is frustrating. And I definitely want to take space for that patients will go to their neurologist for their consistent headaches and migraines, and rightfully so. I mean, why wouldn't you? But let's also run a gut health panel, because if there's inflammation in your body, which is stemming from your gut and dietary choices, or pesticides and glyphosate, I mean, we got to look at all these things too, of what is fueling your body, is fueling all the cells that are consistently leading to that inflammation and overgrowth of unwanted pathogens, for sure.
Mm-hmm. So really, if you're feeling anything that's off,
yeah, come see me. What a good business model, right?
I know, right? I mean, there you go.
Yeah. No, for sure. But I think it is important to realize that common symptoms don't have to be normal symptoms. We don't have to normalize them, like you were saying last episode. But also, it could be that detective work that something's going on in your gut. So, joint pain could definitely be a chiropractic misalignment, C or PT, etc. But it could be just what's going on with your gut. Why is psoriatic arthritis maybe linking it to your gut, or RA, autoimmune disorders, like we were talking about again in last episode too. And it's just crazy. Sometimes you don't think to go to your gut when you're having different symptoms.
Right, absolutely.
And I just find it so interesting that our gut, you're saying it's like kind of the second brain, right? Which is hard to understand in some ways, because we're like, well, it's literally where food goes and gets processed. Like, why?
Mm-hmm.
But so many things that we do in everyday life lead to our gut. Like if you get nervous, you feel it in your gut.
Mm-hmm.
So that's just so interesting. Now, you in your clinic, you offer the gut zoomer test.
Mm-hmm.
So are there different types of gut tests? Why did you choose this one? What makes it different?
Yeah, it seems to be the most comprehensive when looking at gut health. And there's different ways to look at gut health. You can do a stool sample, which is like the gut zoomer, as well as many of the others that you've heard out there. We can also do a blood panel too, just to see what's going on in your circulation. But I really like to look at both a stool sample and sometimes a hair tissue mineral analysis, a HITMA test, because that's important to what's going on with the minerals in your body. Why is that maybe not being absorbed? So these different tests are helpful to see where we're starting at. And it's really good to see biodiversity in your gut. There's certain strains of bacteria that we want to see, and amounts of it too. Oftentimes, if you're eating even the same foods that could be healthy, aren't leading to different pathogens, because you want that biodiversity in your gut, and you want then on top of it more good than bad bacteria. So it's always keeping that healthy ecosystem. And it's also important to look at leaky gut syndrome. Why? And that's such a hot, I think, word right now too, of leaky gut. What is it? It's just these tight junctions that are caused in our lining of our gut. And you want to make sure that they are tight and not open, because we want to keep the good and bad bacteria, as well as the food and nutrients, where they're supposed to be. We don't want those leaking into the bloodstream, because then they get caught in different organs. They are disrupting different pathways and everything like that. So that's very common. I would say most people truly have leaky gut, and they either don't know it or they haven't been diagnosed with it. And it's just important to heal those pathways and decrease that inflammation, so all the nutrients stay where they're supposed to.
What is the cause of leaky gut?
Leading to different pathogens, I would say. Parasites is a big one that we're starting to see a lot of. And both adults and kids should be doing a parasite cleanse, so that can just disrupt the tight junctions. It can just be inflammation. So eating foods, fast foods, the standard American diet can really just disrupt that. And then also just the sugar intake. I mean, that's just crazy how much we're seeing in sugar. And I saw this post and I thought it was so true, that like sugar truly is the culprit of so many things right now, as we know. But like sugar causes cavities in our teeth. Sugar causes dementia in our brain. Sugar causes glaucoma in our eyes. Like there's all these different diagnoses per
sugar is literally the food of cancer.
Yes, absolutely.
Yeah.
Absolutely.
I want to go back to the test real quick too. Like you talked about earlier on like parasites and other things that not just like in your gut, right? So does the gut zoomer test for all the things, or what does it test for specifically, or what does it not test for?
Yeah, it's really going to look at the different commensal bacteria. So that's the good bacteria. And then there's also, we'll list the bad bacteria. So if there is any candida overgrowth, if there's any yeast infections, if there's any, missing strains that we want to add with a pre or probiotic, and just dietary changes. So there are listing a lot of the good bacteria for sure. Certain levels of the gut tumor can definitely test for the bad pathogens, but when it comes to parasites, I would have to double check if that one is listed on there too, but I really encourage that parasite cleanse. And I've been doing so much research on how much parasites really rob us from our nutritional value, but also it's been linked to some other like endometriosis, PCOS. There's a lot of links with reproductive health and parasites. So kind of doing that cleanse for a full detox is super important for people to not only help from their gut health, but also reproductive health too.
So, and I think we may have talked about parasite cleanse in other episodes too, but generally, parasite cleanses, you take, certain supplements, but usually over a full moon, right? Mm-hmm. Do you tend to recommend that once a month, or is it kind of like once every 6 months, or what do you kind of recommend around parasite cleanses so far?
It depends on the patient, but I for sure would say every 6 months, maybe once a year,
sure.
Again, depending on the person's gut health. But before a patient can do a parasite cleanse, it's really important to open up the drainage pathways
sure.
and make sure that their body is able to get rid of those toxins and the die-off cells and the parasites themselves. I mean, if somebody's constipated and they're going to be releasing a parasite, you don't want that thing just sitting there
hanging
and not
out.
being able to pass.
Yeah.
Right. So I encourage patients, like, make sure you're getting the movement, make sure you're on like a vibration plate, make sure you're maybe on like a rebound trampoline or something like that. Even your toddler's trampoline in the
sure.
living room, jump on that, getting your body prepped and ready for some of those drainage pathways. Infrared sauna can really help too. Red light therapy, all these kind of detoxing modalities is really important to get your body ready so that lymphatic system is moving, as well as just other important pathways.
So what does treatment look like if somebody got this gut zoomer test done? And parasite cleanse is a little bit different. We kind of touched on that just now. But if you have higher candida, or you have a fungal infection, or you have leaky gut, or you have too much bad bacteria, what does treatment look like?
Yeah, I would really like to introduce some pre and probiotics, depending on, again, the patient's report and such too. The reports that we pull are just fantastic because they, again, always give lifestyle recommendations first and foremost. So what can we do without intervention of even supplementation and then medication? So what can you do to help clean up things at your home, or what you're improving on for dietary help? But I've also been really researching this new probiotic that is a spore-based probiotic. It's called Megaspore, and it's very interesting. We learned about it in our studies that really help the dominance of poor gut bacteria with the good bacteria too. So there's a couple ones for pregnant moms too that is really important to be taking these spore-based probiotics while they're pregnant, because it's been shown that some of that even transfers for the kids and such too. So that's nice to see that in utero, some of these really good commensal bacteria are being passed into the kids' gut health. And as we know, that gut health then is really transferred through the vaginal canal and then breastfeeding. So it's just wild to me how much of her gut health is truly started in utero from mom, her eating habits, the birth canal, and then also just being breastfed and such too. I mean, that's all the foundations of what we can really help set kids up for success at that point.
Something that a lot of people think about when it comes to gut health is antibiotics too. And I think people are very anti-antibiotics because we know it kills the good bacteria too. But in theory, if you took antibiotics, let's say that you had an overgrowth of some things, and if you took antibiotics, would it literally like clear out your system? Would it clean out the bad bacteria and the parasites and fungal infections and things like that, and kind of give you a clean slate, and then you could just take some probiotics and start to replenish the good bacteria? Or tell us how antibiotics work, and then the pros and cons of them and how to actually get your gut back to a good state.
Yeah, for sure. From my understanding with my background, again, we don't have prescription rights as chiropractors, but just from what we've learned in our studies, it is just definitely going to wipe out the good bacteria, which then leads you to more immunosuppressants because your gut health really directly affects immune health too. So it's important that we are limiting antibiotics. That being said, it's important for a season and a reason, right? But the overuse of them is just not going to be beneficial for most patients, because then your gut health is also really smart and it starts to divert and understand how the pathogens start to switch, because then your body just becomes almost immune to those antibiotics. So it's not even helping at that point too. So there's it's going to wipe out a ton, but there is a season and a reason for it too. So there's an opportunity to just regrow them properly with good foods and pre and probiotics and sometimes postbiotics too.
I think something I find confusing when it comes to our good bacteria, you called that what? Commensal?
Mm-hmm.
Okay. Versus the bad bacteria that we don't want to be overgrown is, do they truly eat different things? Like if you did a test and your bad bacteria was high, and so maybe you're going to do some supplements, right, to help bring those levels back down. Is it truly these two different types of bacteria eat and react in different ways where you're not then destroying your good bacteria at the same time? Like, how do these balance and how do they live in two different worlds, but also, explain some of that to me.
Crazy. Yeah. Every bacteria is going to react differently to different things. So there's going to be different supplements that we recommend based on, the bad bacteria that we see in your gut health. There's going to be different probiotics and strains that we recommend if we need to support some of the good commensal bacteria. I always think of this as like a constant tension in your gut system as well. Like I see like these good like little soldiers and these bad soldiers, and they're always kind of at this competing rate. And you do need a good balance of both. And again, diversity down there, because they need to get rid of the bad pathogens and excrete those appropriately. But then we also need to really nourish our body with the good commensal bacteria as well.
I want to circle back to leaky gut because I know that is such a big thing that so many people are probably dealing with. Can you just walk through what is the time frame that someone would be able to expect if they are on a healing journey for something like leaky gut?
Yeah, again, that's a really tricky one because of patient compliance, right? Because the standard American diet is just going to consistently ruin that. And it's just so hard, I think, as moms and parents, is because we're on the go so much from piano to soccer practice, and we're going to grab that quick Jimmy John's or that quick McDonald's or whatever it is. And that's not to shame or blame or anything, because we've all been there and we need to do a mac and cheese meal once in a while. But it's tricky to say the time frame, because how long have they been dealing with it, right? Is this something that they kind of grew up with on consistent antibiotic use of recurrent ear infections from when they've been a child? Or were they maybe formula fed? And again, that's not a shame or blame. It just is different from the bacteria that we're getting from breast milk. So it's really important to look at the length of time of where their gut health was at. But if somebody is super compliant and somebody is really motivated to change their health and eat, as optimal as we can, I would hope to really see changes within 3 to 6 months. And that's not to say complete symptoms are gone. For some people, I'm sure. But again, it just depends on patient compliance at home, 100%.
And once somebody gets a healthy gut, gets kind of everything back in balance, how do we keep it that way?
Yeah, and that's the number one question, isn't it? I really think a lot of things go into that too, because it isn't just eating organic, pasture-raised, grass-fed, as healthy as we can, but it is also tapping into the other holistic modalities. Like if you're going through a trauma in your life, that really affects your gut health too, and that leads to leaky gut, which is crazy to think, a mental emotional connection like that. But it's important to seek out therapy if you need some support in that way, or prayer, meditation, again, whatever those things are needed. But red light therapy, doing infrared sauna, doing detoxes as well. There's just different timings that are appropriate, but there's things that we can really promote that leaky gut to not come back, if that makes sense.
for sure. And then one other question to kind of finish out this episode with the details behind it is a lot of people listening are moms, and they have kids that are outside, and we want them to be outside digging in dirt. And then they put their dirty fingers in their mouth, and then they are going and, picking a berry out from the wild, and it has a little worm inside of it, and we don't know that. Just like, are these things good? Are these things bad for our gut? Tell us more about just living in nature.
Yeah, absolutely. I would 100% encourage moms to allow their kids to be barefoot in the grass, have that grounding, eat as organic as you can, which is just pulling that berry off, and hopefully it's not sprayed with Roundup and whatnot too. But kind of getting back to like our ancestors, as silly as that sounds, like what were they doing? They were outside all the time, getting good light for their circadian rhythm, balancing their hormones because they were outside. They weren't stuck inside with a screen. They were eating berries right off the tree. They were, again, grounding and sitting in the grass. And so there's opportunities to definitely monitor for our pediatric patients and see if they need a cleanse for parasites, which is we really recommend Cellcore, or Earthly has a really good one too. So Earthly's nice because it's more of a tincture drops that you can follow.
I was going to say, because Cellcore is like these big pills.
For sure. So that's not super pediatric friendly.
No, I can't see my kids ever doing that.
But the Earthly ones are really nice too. And they give you a really nice protocol of what to follow. But with kiddos, it can really look at like eczema. I mean, a lot of patients, I think, do really suffer with constipation or eczema or other skin-related issues. So instead of just naturally running maybe to the dermatologist, like, let's look at their gut health and see if there's any imbalance or maybe some tinctures that we can help change their overgrowth in their gut from candida, cutting out maybe, again, the standard American diet and switching to more home cooked meals and such like that too. But I really want to recognize like the season that most moms are in. I keep going back to it. Like, we're going to meet you where you're at, and we really want to meet your motivation level as well. So that's important to consider when patients come into our door.
Yeah, absolutely.
Is there anything else that families should consider as we're raising up these little kids to help optimize their gut health and set them up for success as they're getting older and into adulthood? So you obviously just touched on a handful of them there. Obviously, we want to try and limit sugar as much as we can. We do want to be outside from birth. Breastfeeding would be ideal if it's possible, just because of that transfer from mom to baby. But is there anything else, any other tips that you can think of off the top of your head that's going to help us set our kids up for success with their gut health?
Yeah, and you just touched on a ton of them too. So thank you for your support with that. But as much as you can, try to eat organic, try to eat grass-fed, try to eat pasture-raised, get things, I know some people aren't into it, but like the raw milk is really great from a local farmer if you can. The grass-fed butter, like there's so much research and just supporting our body with healthy dairy items, but low antibiotics, low hormone things for our fish and our poultry and everything too. So just allowing your kids to still be kids, but try to navigate and talk about food. I don't really remember like growing up talking about the importance of health and how that affects us mentally and physically growing up. So having those conversations, I think, with your kids, like even now for Lucy, my daughter, she knows and can tell when she's had like red dye 40. Like, it's crazy. Like, she's like, Mom, my brain just feels like it's on fire. I'm going crazy, so it's wild that like she can identify that. And like kids are going to be kids. Like, God gave us a liver for a reason to detoxify things, right? But like, you have to live in balance of 80-20, and every family's boundaries around that are going to look different. But I think it is important just to have those conversations with kids of, what does the sugar do to your brain? And how do you feel after eating those Sour Patch Kids? Do you feel like your choices aren't that good? Like, making that awareness for them too, to lead successful lives. And again, balance, because you can also go crazy and be in a complete
definitely
purist.
Ride the guilt train.
For sure.
Right, on both ends.
For sure. Yeah. Absolutely.
This was a great episode just to help give us an intro into gut health. But before we close out, I would love to just know, we talked about how you've been a chiropractor for years now. Now you're branching into functional medicine. You're going to be able to do both of those roles and opportunities for people in our area. But what are you most excited about as you venture into this new journey?
I'm just really excited to bring healing to people's lives. We really want to take the time to look at their mental, emotional piece, their physical well-being, and just kind of being that soundboard to hear them. You know, I think so many people just don't feel heard and they don't feel seen. So I'm just really excited to bring a much needed avenue to the Fox Cities and just be that detective for them and help them along their health journey.
Awesome. I love that. We can't wait to watch you do it.
Thank you.
It's so great. I do want to mention to our listeners that Dr. Mikhaila has offered $50 off of an initial consult with her. The code is FVFM920, so you can go ahead and contact her to book that, and I'll put that in the show notes as well. But if someone wants to get in touch with you, Mikhaila, just to learn more about gut health or any of our discussions from all 4 of these episodes, or if they want to connect with you to potentially be a patient, what's the best way to get a hold of you?
Yeah, our number at the clinic is 920-944-9202, otherwise giving us an email, which is foxvalleyfunctionalmedicine@gmail.com.
Perfect. And what is your website?
foxvalleyfunctionalmedicine.com.
Straightforward.
Yep.
All right. Do you have social media as well that you're active on that they could follow you at?
Yep, absolutely. Both on Facebook and Instagram. A lot of people know me more from 920 Wellness Studio, but they're just sister companies too. But they both have congruent links that you can follow.
Perfect. Yeah, these episodes have been so great. Thank you so much for joining us on the podcast.
Thanks for having me.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.